Most men think better intimacy comes down to technique. Learn the right moves, get the right results. The research tells a genuinely different story, one that most men have never actually heard laid out clearly. What women consistently report wanting most has almost nothing to do with physical skill and everything to do with something men are rarely, if ever, taught directly: genuine presence and communication. In relationship and psychological research spanning decades now, this pattern shows up again and again across different survey populations, different age groups, different cultural contexts, and different relationship lengths, from couples just a few years in to couples decades into a marriage. It's a remarkably consistent finding, and yet it's almost never the message men actually receive from the broader culture around them, which tends to emphasize technique, performance, and physical mechanics almost exclusively. Today, we're reviewing what the evidence actually says about what creates genuine, lasting satisfaction in intimate relationships, why most men end up focused on the wrong variable entirely without realizing it, and what the research shows genuinely makes a measurable, lasting difference. This isn't a list of moves to memorize. It's a framework for understanding what's actually happening beneath the surface of every intimate encounter, and why two physically similar experiences can leave two completely different emotional impressions behind. Multiple relationship satisfaction studies, conducted across different research institutions and using different survey methodologies, have consistently found that emotional connection, communication, and feeling genuinely heard rank above physical technique when women are asked directly what makes intimacy satisfying to them. This isn't a minor or isolated finding buried in one small study. It shows up repeatedly across different survey populations, different age groups, and different relationship lengths, suggesting something genuinely structural about human psychology and connection, rather than a quirk of any one particular study design. This doesn't mean physical comfort, attentiveness, or basic physical compatibility don't matter at all, because they clearly do play some role in overall satisfaction. What the research actually shows is more nuanced than a simple either-or framing. The underlying psychological conditions, feeling safe, feeling genuinely desired rather than simply needed, feeling like a priority rather than a task being completed efficiently, consistently outweigh any specific physical action when researchers ask people what actually predicts their satisfaction over months and years of a relationship rather than any single encounter in isolation. This finding tends to surprise a lot of men when they first encounter it, largely because so much of the cultural messaging aimed at men, from media to informal conversation among friends, emphasizes physical performance almost exclusively, while rarely if ever mentioning presence, communication, or emotional safety as the more consistently significant factors. The actual understanding why this pattern exists requires a brief detour into basic physiology, because this isn't simply a matter of psychological preference or personal taste. It's grounded in measurable, well-understood nervous system function that applies broadly across human physiology, not just in this specific context. Genuine arousal and connection depend fundamentally on the parasympathetic nervous system, the branch of your nervous system responsible for rest, safety, and openness, being the dominant state in that moment. Its counterpart, the sympathetic nervous system, governs alertness and the stress response, the same system responsible for a racing heart before a job interview or a spike of adrenaline during a near miss on the highway. When someone feels rushed, anxious, distracted, or not fully safe and present, the sympathetic nervous system remains at least partially engaged, and this directly interferes with the physiological processes that produce a fuller, more connected experience for both partners involved. This isn't abstract psychological theory dressed up in scientific language. It's measurable physiology. Blood flow patterns, hormone release timing and concentration, and tissue response all differ meaningfully depending on which branch of the nervous system is dominant in a given moment. A rushed, anxious encounter and an unhurried, emotionally present one are, quite literally, different physiological events playing out in the body, even when the specific physical actions involved look broadly similar from the outside looking in. Before continuing further, it's worth pausing on how to appropriately interpret everything discussed in this video. Everything here reflects patterns identified across population-level research, meaning findings that hold true on average across large groups of people studied. It is not a guarantee for any individual relationship, and every couple brings their own specific dynamics, communication styles, cultural background, and individual preferences that shape exactly how these general findings apply to their particular situation. Use this as a framework for understanding broad patterns, not as a rigid checklist that guarantees a specific outcome regardless of your unique circumstances. The most common mistake the research consistently points toward involves men unconsciously treating intimacy as a task oriented toward reaching a specific outcome efficiently, rather than approaching it as a shared, unhurried experience without a rigid endpoint driving the entire interaction. This mindset, even when it comes from a genuinely well-intentioned place, wanting things to go well, wanting to satisfy a partner, can often be sensed by that partner on some level, even when neither person can quite articulate what feels different about the interaction afterward. and it tends to work directly against the safety and presence that research consistently identifies as necessary for deeper connection to actually develop and unfold naturally. Women participating in relationship studies frequently describe this pattern using strikingly similar language across different studies in different populations, describing a sense of feeling managed towards something rather than genuinely mutually shared with, even in cases where nothing about the specific physical actions involved technically changed at all between one encounter and another. The meaningful difference researchers consistently identify sits almost entirely in the underlying orientation, outcome-focused efficiency versus unhurried presence, rather than in any specific technical skill, physical action, or sequence of events. This particular pattern also tends to be culturally reinforced, rather than something men consciously and deliberately choose to adopt. Much of how men are broadly taught to approach challenges throughout their lives efficiently, competently, moving toward a clearly defined goal gets unconsciously applied here as well, even though it represents a fundamentally mismatched framework for something that depends far more heavily on unhurried presence and mutual attunement than on efficient execution toward a predetermined endpoint. Recognizing this as a learned, culturally reinforced pattern rather than some fixed, unchangeable trait is itself genuinely useful, since patterns that were learned indirectly can, with conscious attention, also be unlearned and replaced with something more aligned with what actually produces connection. Survey research examining long-term couples consistently finds that a significant number of women don't voice preferences, concerns, or feedback directly in this specific area of a relationship, and there are several well-documented reasons behind this pattern worth understanding. Some avoid the topic due to not wanting to seem critical of a partner they genuinely care about. Others have had previous experiences in this relationship or an earlier one where offering honest feedback was met with defensiveness, hurt feelings, or withdrawal, which understandably makes raising the topic again feel considerably riskier, and many simply never developed a comfortable, established language for having this particular kind of conversation, since it's rarely modeled openly in most people's upbringing or broader social environment. Whatever the underlying reason in any individual case, the net effect researchers consistently observe is the same. The absence of complaint is not reliable evidence that everything is working as well as it possibly could within a relationship. This is a genuinely important distinction, since it directly contradicts a natural, intuitive assumption most people carry that no news is good news, that silence implies satisfaction by default unless something is specifically said otherwise. Couples who actively build regular low-pressure communication about this topic into their relationship, deliberately outside of any specific intimate moment where emotions and vulnerability run considerably higher, consistently report meaningfully higher satisfaction scores than couples who never discuss it directly and instead rely on assumption, inference, or simple guesswork to navigate this part of their relationship. This finding holds up consistently across multiple independent studies examining long-term relationship satisfaction specifically, rather than being an isolated result from a single research team or methodology. The practical implication here is genuinely straightforward, even though actually initiating this kind of conversation can understandably feel uncomfortable at first, particularly for couples who've never established this habit before. Creating deliberate space for honest, non-judgmental communication, and then genuinely receiving whatever a partner chooses to share without becoming defensive or dismissive, appears throughout the research to matter more for long-term relationship satisfaction than any single specific technique a man might otherwise learn or attempt to master. We're now roughly halfway through this video, and this represents a natural point where the research shifts from establishing broad, general findings toward examining more specific, directly actionable patterns worth understanding in greater depth. Everything discussed up to this point establishes the overarching framework: connection and communication consistently outweighing technique in predicting genuine satisfaction. What follows looks more closely at exactly what that broad framework means in day-to-day practice, and where the supporting evidence becomes somewhat more nuanced and situation-dependent. Research examining the neurochemistry underlying intimate connection consistently points to oxytocin, sometimes informally referred to as the bonding hormone, as central to explaining why genuine presence and focused attention produce a qualitatively different experience than the exact same physical actions performed with divided attention or underlying anxiety present in the background. Oxytocin release during intimate physical contact is measurably amplified under a specific identifiable set of conditions: genuine emotional safety, unhurried presence rather than rushed urgency, and authentic mutual attention directed toward the shared experience rather than distraction pulling focus elsewhere or performance-related anxiety consuming mental bandwidth that would otherwise support genuine connection. This represents a documented, measurable physiological event captured in research settings, not simply a vague subjective feeling that resists objective study. This helps explain something a great many people have genuinely experienced firsthand without ever having accurate language to describe what they were actually noticing. Two encounters that appear physically quite similar on the surface can nonetheless produce noticeably, sometimes dramatically, different senses of closeness and satisfaction in their aftermath, and that meaningful difference tracks consistently with the underlying psychological and physiological conditions present in each instance: safety, presence, genuine attention, rather than with the specific physical actions themselves, which may have looked nearly identical from an outside observer's perspective. A third significant pattern that surfaces repeatedly across relationship and psychological research involves men mentally evaluating their own performance in real time during intimate moments, rather than remaining genuinely fully present with their partner throughout the shared experience. This particular form of self-monitoring, while it usually stems from a genuinely caring place, a sincere desire for things to go well for both people involved, is itself, physiologically speaking, a form of the exact same stress response discussed earlier in this video, and it's frequently noticeable to a partner on some intuitive level, even in situations where she can't quite consciously articulate what specifically feels different about that particular encounter compared to others. Research examining performance anxiety more broadly across various contexts, not limited to intimate relationships specifically, consistently supports this general pattern. Anxiety focused on a particular outcome tends to directly interfere with achieving that very outcome, creating a frustrating self-reinforcing cycle that can be genuinely difficult to break without conscious, deliberate intervention. The research-supported alternative to this pattern isn't trying harder to perform well, which paradoxically tends to increase rather than decrease the underlying self-monitoring causing the difficulty in the first place. It's consciously and deliberately redirecting attention toward genuine presence with a partner instead, which represents a learnable, practicable psychological shift rather than some fixed, innate trait that certain men simply possess naturally while others are permanently excluded from developing. It's worth dedicating additional attention specifically to communication, since it consistently emerges as the single most frequently cited factor across the body of research reviewed for this video, appearing again and again regardless of which specific study or research team conducted the underlying work. Studies examining long-term couples have repeatedly found that partners who communicate openly about preferences, comfort levels, and pacing throughout their relationship report meaningfully higher satisfaction scores than couples who consistently avoid the topic and rely instead on assumption or inference to guide their shared experiences together. This finding connects directly back to the nervous system mechanism discussed earlier in this video. Uncertainty and unspoken assumption create a persistent, low-grade background tension within a relationship, keeping the stress response at least partially engaged even during moments specifically intended for connection and closeness, which works directly against the safety and presence that deeper connection consistently depends on, according to the research. Direct, ongoing communication actively removes that background uncertainty, functioning as a genuinely practical tool with a measurable physiological effect on both partners, rather than existing merely as generic relationship advice offered in the abstract without any real mechanistic backing. Before moving to the next point, if you're looking for a broader framework specifically addressing men's health after 40, including how physical health connects meaningfully to relationships and overall vitality, Dr. Emily Carter's guide, The Iron Age, the complete blueprint to reclaiming testosterone, strength, and vitality after 40, was written specifically to bring these interconnected topics together in one organized place. It's a concise 14-page guide containing 9 focused chapters covering testosterone, strength, energy, and vitality after 40. It's priced at $49.99, and you can find the link provided with this video. It's educational in nature, not a replacement for individualized medical or relationship counseling, but it offers a genuinely clear framework to build from as you continue thinking through these interconnected areas of your health and relationships. Returning to the core research itself, it's worth specifically addressing how these general findings shift somewhat for men in longer-term relationships, since a meaningful portion of the audience watching this particular video likely fits that description directly. For women navigating hormonal changes commonly associated with aging, particularly around and after menopause, the physiological arousal process described throughout much of the research often requires more unhurried time and more deliberate, sustained presence than it may have required at a considerably younger age. This represents a normal, expected physiological shift rather than any kind of decline that should cause alarm or concern, and it means the core principles discussed throughout this video, patience, genuine presence, and open communication, become more rather than less relevant with the passage of time, even though broader cultural conversation around this general topic tends to focus disproportionately on younger couples navigating early relationships. Research examining long-term couples specifically also finds that communication patterns established relatively early in a relationship tend to persist and compound over subsequent years and decades. This means couples who successfully build open, low-pressure communication habits early in their relationship tend to maintain and even strengthen that pattern over time, While couples who avoid the topic entirely in earlier years tend to continue avoiding it for years or even decades afterward, unless something specific, a health event, a deliberate conversation, content like this video prompts a genuine change in that established pattern. Something that connects directly to nearly every other topic covered on this channel is genuinely worth mentioning here as well. General life stress, whether from work demands, financial pressure, health concerns, or simply the accumulated weight of daily responsibilities, measurably affects a couple's overall capacity for the kind of presence and connection this entire video has been examining in detail. Chronic background stress keeps the nervous system's stress response at least partially engaged even during moments specifically intended for connection and closeness, meaning a couple can apply every single principle discussed throughout this video correctly and consistently, and still find the resulting experience feels somewhat flat or incomplete if one or both partners happen to be carrying significant unaddressed stress from entirely unrelated areas of their life. This is precisely why addressing sleep quality, effective stress management, and overall physical health, the broader interconnected themes covered consistently throughout this channel, connects directly back to this specific topic rather than existing as some separate, entirely unrelated concern, siloed off from everything else affecting a man's overall well-being. Here's the finding that genuinely matters most in my assessment of this research, and it's also the finding most frequently omitted entirely from typical content covering this general topic. Research examining couples who successfully improve their satisfaction over meaningful periods of time doesn't consistently point to learning specific new techniques as the primary driver behind that improvement. It points instead toward building an ongoing, sustained practice of communication and genuine presence treated as a continuing, evolving conversation rather than a single fix applied once and then considered permanently resolved. Couples who check in with each other periodically, who treat comfort levels and preferences as something that naturally evolves and shifts over time, rather than something settled definitively once and never revisited again, consistently report the most stable, satisfying, long-term outcomes throughout the research literature. This finding meaningfully reframes the entire question most men initially start with when approaching this topic. It's rarely in the end about learning some specific new technique that unlocks better results. It's fundamentally about building the ongoing conditions, safety, presence, and honest, sustained communication, under which genuine connection can actually continue developing and deepening over the full span of a relationship. Since communication emerges consistently as the single most frequently cited factor throughout this body of research, it's worth addressing quite practically how to actually raise this particular topic, since simply understanding its documented importance is only genuinely useful if that understanding translates into an actual real conversation with your partner. Research examining effective communication between couples suggests that raising sensitive topics outside of any emotionally charged moment in a genuinely neutral, low-pressure setting removed from any specific intimate encounter tends to produce meaningfully better outcomes than attempting to raise the same topic immediately, during or right after an intimate moment, when both partners may feel considerably more vulnerable and correspondingly more likely to interpret any feedback offered as personal criticism rather than genuine curiosity. A simple, sincerely curious question, framed without defensiveness or an implied agenda, tends to open this kind of conversation considerably more effectively than a more clinical, formal, or heavily prepared approach that can inadvertently feel scripted or impersonal. It's genuinely worth being clear about the specific circumstances when this general framework, communication, presence, patience, isn't fully sufficient on its own to resolve deeper difficulties within a relationship. Persistent, significant dissatisfaction within a relationship, particularly when it's accompanied by broader relationship conflict extending well beyond this specific topic alone, may genuinely benefit more from working directly with a licensed couples therapist than from attempting to apply general research findings entirely independently, without professional guidance or support. Similarly, if either partner happens to be experiencing symptoms like persistent low libido, physical pain during intimacy, or significant anxiety specifically centered around this particular topic, that combination of symptoms genuinely warrants a direct conversation with a doctor, since underlying medical or psychological factors contributing to these symptoms are genuinely common in the broader population and are frequently quite treatable once properly identified and addressed through appropriate medical or therapeutic channels. Before wrapping up, it's worth briefly addressing why this specific gap in understanding exists so consistently across generations of men, since understanding the root cause helps explain why so many men reach their 40s, 50s, and beyond without ever encountering this research directly. Most early exposure to this general topic for most men comes from informal, incomplete sources, media portrayals, casual conversation among friends, or simple assumption, rather than anything resembling accurate psychological or physiological research. Cultural messaging aimed at men has historically emphasized physical performance and technique almost exclusively, largely because that's the visible, easily discussed, easily marketed piece of this topic. While the nervous system, emotional safety, and communication research discussed throughout this video rarely fits neatly into that same cultural conversation if it's included at all. This creates a genuinely strange, persistent gap where men can be, by every external measure, experienced and capable in most areas of their lives, while still missing the specific research-backed principles that actually determine whether an experience feels deeply connecting or simply functional and forgettable. Recognizing this as a widespread information gap, rather than a personal failing or deficiency, is itself a genuinely useful reframe, since it means this is entirely learnable, rather than some fixed trait men either naturally possess or permanently lack. It's also worth directly addressing the role media portrayals play in setting unrealistic expectations around this entire topic, since the downstream effects show up consistently in relationship research examining men's expectations and self-perception. Much of what men are exposed to through entertainment media presents an unrealistic picture emphasizing speed, intensity, and physical performance almost exclusively, while almost entirely omitting the nervous system, emotional safety, and communication principles discussed throughout this video. This creates a genuinely distorted set of expectations, both about what should be happening physically and, more subtly, about what actually produces satisfaction and connection in a real ongoing relationship rather than a scripted, edited portrayal. Men who've internalized these unrealistic portrayals often experience a persistent, low-grade sense that something is wrong, either with themselves or their relationship, simply because their actual lived experience doesn't match an inaccurate template they were never given the tools to recognize as inaccurate in the first place. Understanding the actual research discussed throughout this video tends to resolve a meaningful portion of this underlying anxiety on its own, simply by replacing an unrealistic, distorted mental model with one that's genuinely grounded in evidence. One final point worth emphasizing before closing out this video: there's a natural temptation to treat everything discussed here as a single insight to apply once and then consider permanently resolved. The research doesn't support that framing. Couples who maintain the deepest, most stable sense of connection over years and decades aren't the ones who found some singular, permanent fix at one specific point in time. They're the ones who treat communication, presence, and mutual attentiveness as an ongoing, evolving practice that continues adapting as both partners age, as life circumstances shift, and as new stressors or health changes inevitably emerge over time. This mirrors a pattern that shows up across nearly every other topic covered on this channel about men's health more broadly. Sleep, strength training, stress management, none of these represent one-time fixes either. They're ongoing practices requiring consistent, sustained attention rather than a single successful intervention followed by permanent maintenance-free results. If anything discussed in this video genuinely resonated, treating it as the beginning of an ongoing conversation with your partner rather than a single insight to apply once and then set aside indefinitely is what the research consistently suggests produces the most meaningful, lasting results over time. So here's the bottom line to take away from everything discussed throughout this video. What research consistently shows women value most within intimate relationships isn't any specific technique or physical skill. It's genuine presence, patience instead of urgency, and open, ongoing communication instead of silent assumption. The underlying neurochemistry involved, particularly oxytocin release and its amplification under specific conditions, responds directly and measurably to these particular conditions, which is exactly why the same physical actions can feel entirely dramatically different depending on the psychological context surrounding and shaping that particular experience. 3. Practical takeaways worth carrying forward from this video. Focus consistently on presence over performance. Since the research consistently shows this factor matters considerably more than any specific technique across virtually every study examined. Build regular, genuinely low-pressure communication into your relationship rather than simply assuming that silence automatically means satisfaction. And recognize clearly that persistent difficulty in this particular area may genuinely warrant professional support, whether from a qualified couples therapist or a medical doctor, rather than something that necessarily needs to be worked through entirely alone without any outside guidance or support. If anything discussed in this video resonated with your own experience, that's genuinely worth bringing directly into an honest conversation with your partner. The Iron Age Guide is linked with this video if you're looking for the broader picture on men's health after 40. Thanks for watching, and I'll see you in the next one.